All right, everyone. This is Dr. Ginger Garner here with you again. Welcome to part 2 of our video series on what to do when this is tight, but you can't move that well. There are several ways that we can approach this. Now, we're assuming that someone has had, if you're watching this video, you either can't move very well, you're pregnant, which kind of covers that base, or you've recently had a hip scope and it's really hard for you to get out and do the activity that you want. You could have also had another type of surgery where you're on an assisted device for a long time and things are just really tightening up through here. Can also even feel like tightness into here, but especially tightness in the rib cage and into the low back area. You're going to need 2 yoga blankets, Mexican blankets, or something, anything that won't collapse underneath you. I'm getting one more blanket out here. I'm a bit of a stickler for blanket folding, so I want you to look up Ganesha Fold if you don't know how to fold this blanket, because we're using Ganesha Fold here. Right. Your blanket is only going to be as wide as your shoulders. In fact, just a little bit more narrow than your shoulder width. Once you fold it into the Ganesha Fold configuration, which looks like this, note that blankets make the pose harder, not easier. So if you want to make the pose more intense, I want you to make the elephant fold of the Ganesha here taller and more round. Let's say that my right side is what is tight. I'm going to put the most flexible part of my torso over those blanket rolls. My pelvis is supported by the bottom of the blanket and my shoulder is supported by the top. I'd like for you to just rest your head on your arm if you can. Now the first thing that you're going to do is just notice if this is tight in this area, right? Hopefully you're testing this video out because that's what you're feeling. But I want you to check into it a little bit more deeply with your breath. Inhale. No chest breathing. I just want you to feel your ribs expand laterally this way and back. Imagine you're breathing like fish gills, right? Inhale, fish gills open. Exhale, they close. Inhale, expansion and they open. Exhale, they close. Right? So if you haven't watched part 1 of the video yet, now might be a good time to do that, because it teaches you against the grain breathing, which is what we're going to use now. Go ahead and try and lengthen the leg. That's one option you can do. Lengthen the leg out and experiment with rotating. That means you may need to move your shoulder over a little bit to stay on the blankets. Rotate and reach and really try to feel the rib cage expand. That's about a 4 count. Inhale, hold for 4 counts. And exhale, 2, 3, 4. You can reach the leg out if you want, reach the arm. Inhale, hold. And exhale, 2, 3. Use your exhale, elongate it to experiment with moving. So on the exhalation, moving. On the inhale, I want you to feel the respiratory diaphragm go down, the pelvic floor go down. Hold, expand the rib cage. And exhale, experiment with moving. Inhale. Hold. And exhale. You can always feel free to experiment as long as you want with this side lying over Ganesha Fold. But I encourage you to use a deeper, longer breath. What we were really targeting there, and you don't have to stop doing it just because I am, you can keep going with it. We were breathing about 4 to 5 times a minute. That's a therapeutic dose, right? Of breathing, of respiration. We can't breathe like that all day. But for purposes of calming yourself, managing pain, becoming more mindful, slowing down, creating openness and space, all of the good things that we want in life, the breath is the key. So you'll be inhaling for 4, holding for 4, and then exhaling for at least a count of 4. If you will use sound, like a or even a ha sound with the mouth closed, which is an Ujjayi breath in yoga, which sounds like this, kind of Darth Vader-ish. That will elongate your exhale. And if any of you out there have struggled with respiratory issues, asthma, allergies, or long COVID, God forbid, that Ujjayi breath will really help expel the rest of the air from the lungs that can get kind of stuck and stale there. So I hope this has helped you out with creating elongation, opening, a more fluid and flexible feel in the low back. Maybe it has improved your mindfulness and your stress and your pain all at the same time. So until next time, take care of yourself.